Today's topic C is brain controlled implant that can decode which speaker a person is attending and attending to and amplify that voice in real time, suggesting a future alternative to conventional hearing aids for noisy environments. Okay, that's discussion C for you. We're discussing that. So let's go get the show started. Researchers at Columbia University's Zuxman Institute tested a brain controlled hearing system that decodes attention from neuronal signals and uses that signal to enhance the attended speaker while suppressing others. The work was published in Nature Neuroscience and reported on May 11, 2026. Zuckerman's Institute, Columbia EDU. Methods, how the system works. Participants, people already implanted with intercanal electrodes for epilepsy, monitoring volunteered for the experiment. Tasks. Volunteers listened to two overlapping conversations and were instructed to attend to one. Decoding and processing. Algorithms decoded which conversation the brain was tracking from the electrode signals, and then adjusted audio processing to amplify the attended voice and quiet the other in real time. Key results. The system reliably identified the attended speaker from neuronal activity and produced perceptible improvements in the listener's ability to follow that speaker in a two talker test. Several volunteers reported the effect was shockingly intuitive. One accused researchers of secretly changing volumes because the brain driven control felt so immediate. Conversational hearing aids amplify all sounds, which makes it hard to follow a single voice in crowded settings. This implant targets the listener's attention rather than raw sound level, offering a fundamentally different approach. Potential benefits: restoring selective hearing, the cocktail party effect could dramatically improve communication in noisy places for people with hearing loss. Limitations and risks: early stage, small, small human sample tests used patients already undergoing invasive monitoring. Results do not yet generalize to typical hearing loss populations. Invasiveness: current demonstrations rely on intracranial electrodes, surgical implantation carries medical risks and is not comparable to non-invasive hearing aids. Technical and ethical challenges: long-term stability, decoding device safety, privacy, and privacy of neuronal data, and regulatory approval remain unresolved. Practical takeaways and next steps. Key consideration before this becomes a consumer option: surgical risks, tolerance, whether non invasive decoding or EEG or ear canal sensors can reach similar accuracy. Regulatory and privacy frameworks. Next research steps include large trials in people with hearing loss, efforts to move from intracranial to less invasive sensors, and long-term safety testing. This study provides first human evidence that bionic attention driven implant can isolate a single speaker in a noisy settings. An implant, an, imp, an important proof of concept, but widespread clinical use is still years away because of invasiveness, limited samples, and technical ethical hurdles. Okay, guys, that is your C for this afternoon. I will be back on later for more shows. For now, Gator Wellness, take care, folks.